Hi, my name is Laura DeFina. I am the medical director of the Cooper Institute in Dallas, Texas, and I'm going to talk about my study looking at the effect of midlife cardiorespiratory fitness on the development of Alzheimer's disease and related disorders in later life. What we did in this study is took the existing Cooper Center longitudinal study database, which is a preventive medicine cohort that has an objective measure of cardiorespiratory fitness based on midlife maximum bulky treadmill testing. We then looked at the diagnosis of Alzheimer's disease and related disorders utilizing the Medicare administrative claims data and used a diagnosis that was based on having at least one claim for Alzheimer's disease and related disorders, and there's actually 30 codes, I believe, ICD-9 codes that define that diagnosis, and they had to have at least a diagnosis over the course of a 3-year interval. This particular measurement of dementia has been validated in other dementia cohorts and has a reasonably good sensitivity and specificity. So what we looked at is midlife cardiorespiratory fitness and looked at the population 23.7 years later and found that there was an inverse relationship between fitness at midlife and the development of Alzheimer's disease and related disorders in later life. The nice point about this study is that fitness is a very good measure of habitual physical activity, where physical activity that's self-report is fraught with errors of over-reporting, I suspect. And so this is a good marker, and it addresses some of the issues from the NIH consensus looking at preventive measures for Alzheimer's disease. It's a long study. It has a rigorous midlife exposure and a rigorous diagnosis of dementia in later life.